I'm Dr. Chandra Sekhar, Gastroenterologist at KIMS Hospital, Secunderabad. I have 19 years experience in UK. Today, I would like to discuss a common problem which we all encounter, which is anemia. If you see here, the red cell counts are normally less. So, the topics I'm going to discuss today is what is anemia, which is low blood count, or hemoglobin is low. What symptoms do you get from it? Is there anything that you need to worry about in anemia? What are the complications of it? And what are the tests that you need to have it? And I would like to tailor this anemia to the population of India, as this is a very common problem in India, especially in people who are vegetarians, women who are menstruating, or certain group of people where they have different types of anemias called thalassemias. And I would like to address this problem. Along with that, I would also like to address which type of anemias you need to have gastroenterology investigations. The symptoms of anemia, most people complain they are tired. The reason why they feel tired is because the blood, red cells, if you look at these ones, are the ones which carry the oxygen to different parts of the organs. When they're less in number, the organs don't get enough oxygen, and if anything they want to do more exercise, they just feel tired. That's one of the things. Also, the heart has to work double the time because it has to pump more times to feed the oxygen to the organs, so they get palpitation. That means they feel like the sensation of the heart beating, which we don't normally feel. That's called palpitations. People get headache, and other common symptoms which they feel are just mentioned over here, like some people lose the hair if they got low iron, and some people have dry skin and various other things. And people do manifest the causes of the anemia in a different manners, like they have bleeding. For example, if they have some problem within the gastrointestinal tract, they will manifest as they have problems swallowing, or they have tummy pain because an ulcer is there, or if they got cancers, they also bleed from the GI tract, which can give them black stools or red stools. Okay, so the common symptoms people tend to present with anemia are, as I mentioned to you, the feeling tiredness, headaches, and palpitations, dry skin, hair loss, and various other small other symptoms. This is extremely important because we tailor the investigations or treatment depending on the cause of anemia. Generally, when somebody shows me a blood result showing their hemoglobin is low, which is basically less than 10, first thing I look at is it a female gender or male gender? The reason is that anything low in male, with the low blood count in male, is something that you need to look at immediately. And for female, especially people who in the menstruation periods, they tend to lose iron or blood every month. If they're having heavy periods, they lose more. Hence, they can be anemic. So, if there is an accounting factor for them to be anemic, then we also look at if they have any GI symptoms, and that's how we proceed with the investigations. So, to break it down easily, what I say is it coming from the GI tract, which is either the vomiting blood, or the passing black stools, or they have diarrhea, sometimes celiac disease, various other factors are there where they don't absorb enough nutrients is a big factor. As I said, is there any menstrual problems? The pregnant women can be anemic. Or most common thing is people take painkillers. Common painkillers that can cause bleeding are diclofenac, which is Voltarol they say, and ibuprofen. The reason is that we all have gastric problems, and when you take painkillers like this, like diclofenac or brufen, they cause ulcers, and these ulcers can cause slow bleeding that you can't see with your naked eyes. So you think like, okay, I'm not passing any blood, and why am I losing blood? That's a common question that patients do ask me. But if you're bleeding drop by drop, very little, then you might not see that. If the only point where you see huge blood is something that you pour like this. That's the only thing they'll consider. But taking brufen or Voltron is very important. Are people who has malabsorption, that means a condition where they don't absorb the enough nutrients, for example celiac disease, or people who have surgeries on the small bowel, they also don't actually absorb iron. And the most important factor that I want to explain is the diet, and this is very common in Asian population. So the reason is that some people can be vegetarians, which they don't have a lot of vitamin B12 or iron in their food. That can cause that, and and the other factors that, the foods that are rich in iron are normally red meat, which is they call the mutton in this place, which is red meat. That's the best in iron, rich in iron content. Chicken don't have that much iron. So diet is a big factor here when they have anemia. So that's why we always tend to see are the vegetarians or not. And then other factors that can cause bleeding are the people who's got internal piles. If they are bleeding so much and they can't replace that by the normal iron intake, then they can be anemic. And the most important thing we consider in gastroenterology are the cancers. They can happen anywhere. They can start from the food pipe or in the large bowel, or anywhere in the bowel. So then they tend to lose blood slowly, and that's where we come in and we tend to investigate those patients. What is the strategy of diagnosing or making a management plan for these patients of anemia is the most important. As I rightly said in the beginning, saying that you need to know which group of patients are we dealing with in anemia. So as I said, like somebody brings a blood count to say their hemoglobin is 9, for example. Then you look at it, is this low blood count, is something happened in the last week or month? Is very, very important, because that means something has changed for us to act quickly. Or if it's been a chronic for long time, for example, the blood count has always been 9, for example, for 10 years or 5 years or 6 years, there's nothing to worry. Then we need to address why these people have low blood count. For example, the most common thing I'm noticing here is the thalassemia. Thalassemia is a type of a blood condition where you tend to have a smaller red cells and your blood count tends to be low. So these are called hemoglobinopathies. So when I see low blood count with extremely low MCV, which is the size of the cell, then I tend to look at the hemoglobin electrophoresis to actually see which type of hemoglobinopathies are there, which is very important. If you start from there, then you don't need to do unnecessary invasive tests, for example. You don't need that. So I recently had a kid who is 19 years old and he had COVID, and then the father brought me blood results and I seen the hemoglobin is low, and at the same time his MCV was like 69. So obviously, he's not bleeding, he's a man, and things like that. We just have to go along with that. And patients who are taking these painkillers is important. If they're women, if they're menstruating, that's also important. And if they have symptoms in the gastrointestinal tract, and we tend to investigate by putting the tube down the mouth, which is called gastroscopy, or we go on the back end called colonoscopy. Or sometimes if they're losing weight, we do tend to do scans, CT scans. So the treatment for these anemias, depending on the type of anemia. So first of all, we need to establish, is it iron deficiency anemia? By this, what I mean is that we check your ferritin, we check your iron levels, and if they are low, we tend to replace them with the oral iron, which can be tablet form or liquid form. And some people still don't absorb by giving the medication by mouth, then they need injections, iron injections, which is very, very important. Or sometimes people tend to lose blood in the gastrointestinal tract. By this, we go inside and then close the leak where it's happening. So some people are chronic anemia from menstrual periods, then we ask the gynecologist to actually tackle the problem, or if it can be related to the diet, and we give the diet advice for these patients. If you need any clarification or any information regarding the anemia, please contact me at KIMS Hospital, Secunderabad, between 9 a.m. to 4 p.m. Many thanks.